We have so far covered rate, rhythm, and axis. And if you recall, the formula for that was R Rahi, that was rate, rhythm, axis, hypertrophy, and infarction. Um, the difficult one is axis, which we've done. If you have any questions in that regard, please give me a feedback. Next is hypertrophy and infarction. These are relatively easier on an ECG. So I've got my two ECGs in front of me and a piece of paper. So hypertrophy either can be atrial hypertrophy or it can be ventricular hypertrophy. The P wave denotes the atria and the QRS complex denotes the ventricles. If you've got atrial hypertrophy, you'll get abnormality in the P wave. The P wave is normally composed of two parts, the initial and the latter bit. The initial part is from the right atrium and the latter part is from the left atrium. And they merge in the middle, and therefore what we see is a dome. But actually, they're two waves which are merging together. If you get a hypertrophic wave on an ECG, which is atrial hypertrophic wave, if it's tall, then it's a P wave coming from the right atrium. And right atrium means that there is something, perhaps there is pulmonary hypertension or there is a tricuspid regurgitation, whatever there is, but that has caused hypertrophy. And if you've got hypertrophy of the left atrium, for instance, in mitral stenosis or mitral regurgitation or mixed mitral valve disease, or you've got severe cardiomyopathy, that the left ventricle has hypertrophied, in that case, you'll get a broad P wave, may or may not have a double hump, but it's a broader P wave. And that's how you can easily find out if there is right or a left atrial hypertrophy. Now, when it comes to ventricular hypertrophy, what we see is the left or the right ventricle. And if you remember from when we checked the axis, the lead AVL is the one which, if you remember, when we looked at the axis, we found that lead AVL was actually facing towards the left shoulder. And lead AVL or lead 1, these are the primary leads which are facing towards the left ventricle. And the other leads which are facing towards the right ventricle are usually the chest leads. So for right ventricular hypertrophy, we normally see the chest leads, V1 and V2. But for the other leads, we check the AVL, and we also check V3. If the R wave in AVL and S wave in V3, if collectively they are greater than 28 millimeters in a male and greater than 20 millimeters in a female, then this is called as left ventricular hypertrophy. So you need to look at AVL and then V3. If you've got in V1 and V2, you've got large R waves compared to S waves with a right axis deviation, then this is right ventricular hypertrophy. So here I've got an ECG, and let's see if we've got any hyper small squares. So you don't see a P wave taller than two small squares and not broader than two small squares. So that means in this particular ECG, there is no atrial hypertrophy. Now let's see if we got ventricular hypertrophy. We look at lead AVL and we see that no, we don't have at all R wave, and we look at V3, and in V3, we don't have a deep S wave. So looking at these two leads, we know that there is no left ventricular hypertrophy. But likewise, let's see if there is any right ventricular hypertrophy. So we'll see lead V1 and V2, and we'll see the height of the R waves. And we see in lead V1 and V2, we don't see any tall R waves in V1, but we see very tall R waves in V2 and V3. So tall R waves in V2 and V3, they are not synonymous with right ventricular hypertrophy because you need right axis deviation as well. But there is perhaps an element of right ventricular hypertrophy in this one, but it doesn't fit the criteria. So likewise, in this particular ECG in which we had left axis deviation, once again we'll see lead AVL and we'll see lead V1. And so it has to be greater than 28 millimeters, but I just counted that, and it's not 28, so it's about 18. So this does not fit the criteria of a left ventricular hypertrophy. Likewise, you don't have broad or pointed P waves, so you don't have right or left atrial hypertrophy. But if you had them, you would obviously see very tall R waves in the respective leads. Thank you.